Why would you not want to do something to save your life?
I think that's my biggest thing, is just getting through the system to get the help.
The main challenge is just my health and keeping healthy.
Letting medical science cure your disease. Investigate, do your research. I'm a living example. You can beat the disease.
It's not an easy treatment, no.
Hepatitis C is a chronic illness affecting over 250,000 Canadians. Most will live with it for decades, but without checkups or the appropriate self-care, progressive liver disease could go unchecked, even while treatments are available. Yet for unknown reasons, many are not seeking care for this illness. To find out why, researchers from the University of British Columbia completed a national research project. Hi, I'm Lisa McGuinness, one of the research team. In this documentary video, people living with hepatitis C and service providers volunteered to speak about their own experiences that help to illustrate some of the research findings. Their stories are of interest to service providers reaching out to those with hepatitis C and to people living with the disease who are seeking to have their voice heard. The research team interviewed both people living with hepatitis C and service providers across Canada. 84 people from 6 provinces participated through phone interviews and focus groups. Our team is based in Vancouver, guided by a national advisory committee of experts and people affected by the illness. Dr. Gail Butt is the project lead.
We found there were 6 reasons for people not attending for care or deferring or delaying care. The first 4 reasons really dealt with relationships between the person and the provider. The other 2 dealt with systems issues. So the things that were interpersonal, where people protected themselves from the stigma and discrimination, we called self-protection. They also had difficulty seeing the benefit of attendance sometimes, and they also had to weigh their competing priorities. The other thing that sometimes I think spurs the stigma and discrimination were the knowledge gaps and difficulty understanding the health information that they were given, which I would call health literacy. The last 2 things that were system-wide were actually difficulty accessing services and services that had very restrictive policies. But what we found generally was people were quite vague about how frequently they went. Some people didn't go for many years. Some people were told on diagnosis it wasn't necessary to return for care, that they would be able to live a healthy and good life as long as they abstained from alcohol use and took care of themselves and ate well and lived a healthy lifestyle. So there were lots of reasons why people with hepatitis C didn't even know they should go for care or monitoring.
In this video, we'll look more closely at the first 4 themes. But first, who is affected by hepatitis C?
It's important to realize that in Canada, most of the infections have occurred in people who've injected drugs in the past or currently, men who have sex with men, people who've immigrated from certain endemic countries, refugees from endemic countries. Aboriginal populations are more affected by hepatitis C, and people who've been in correctional facilities. And so there tends to be a stigma for these populations about where they got their infection. But the important point is not to be judgmental and to also create a capacity in the community to express their voice, and they need to get the same kind of care that anyone else gets in terms of other illnesses like cancer. So it's really important for the community to coalesce and to express its need, because hepatitis C is both a preventable illness as well as a treatable illness. And being able to marshal support to get the right kind of services, being able to articulate which services are necessary for their own well-being is a very crucial point.
So what do we hope to achieve with the results? I think most importantly is getting the information out there, looking at the gaps in the information for healthcare providers and looking at how we can fill those gaps as an educator, looking at developing programs for healthcare providers. And then for people living with hepatitis C, looking at how we can fill the gaps for the access to services, because there is definitely a barrier to services.
See on your chart, hepatitis C, they treat you a lot different.
And I found that sometimes you're just kind of shuffled off into a corner.
I would like to see people treated as people no matter what their background.
People said they often didn't seek care because of unpleasant past experiences with providers. These incidences sometimes discouraged them from getting tested, disclosing their diagnosis, or choosing treatment. In our research, we identified one of the reasons for non-attendance is self-protection. In other words, the ways in which people deal with stigma.
Initially, the shock of finding out that I had it was very disheartening. Because I present well, I don't experience a lot of the challenges that our client base does, and that's a big factor. The healthcare profession tends to reserve the right to make judgment as to who gets treated and how well. And it comes through, and that's why a lot of our clients will not go to hospitals and seek treatment, because they get treated so poorly they'd just rather not.
But even in our almost rural setting, the emergency ward is not too kind to people that don't present well. So a couple episodes like that and people don't want to go back there.
When I found out that I had hepatitis C, as a nurse, I thought, you know, okay, this is a disease that lots of people get. And when I started talking to friends and colleagues at work, I was really surprised at that negative stigma that it still had with it. I thought as healthcare professionals that we had sort of gotten past that we'd gotten past the HIV and Hep C, and that's what I found that they were doing, was they were lumping hepatitis C and HIV all together. When I started to tell other nurses that I had hepatitis C, it was really interesting because people would come to me after the conversations and just on a one-to-one basis would say, you know what, I've got hepatitis C too, but it was like, don't tell anybody. Nurses were afraid that, you know, if people found out that we would be sort of ostracized, and that whole stigma with hepatitis C was still very much there and very active in the nursing population as well. So that was a surprise for me. Thought that healthcare professionals would be more understanding of that, but definitely the fear and the lack of knowledge is still very prevalent in the healthcare community.
We've had a few cases where young women that are coming from other countries, they find out they have hepatitis C, and they've been afraid that their families back home are going to reject them because of the diagnosis. And we even had one case where the wife actually managed to hide her diagnosis and her treatment from her husband and her children.
Coming from a nursing background, we go through an assessment when you first meet a client, and part of the assessment is identifying their risk factors. A simple question. So what are your risk factors? You know, how do you think you got hepatitis C? During the interviews, we didn't ask that. And at the end of each interview, we said to the participants, is there anything that we didn't ask that you were expecting us to ask? Quite a few of the participants acknowledged this and said, well, I was surprised you didn't ask me how I got it. And to them, that was huge. That was a huge, they thanked us for not asking that and making that assumption, or starting off the interview with a stigma on how they got it.
Not asking people how they acquired the virus and protecting confidentiality builds trust. Being mindful of your comments and assumptions and the potential to stigmatize also fosters healthy, open relationships.
When people come for help, they're already in a very vulnerable place, and they're very sensitive to judgment. And I think it's important to remember that at least part of our job is to make people feel like they're normal and their concerns are normal, their lives are normal and that, they're just like everyone else.
I think relationships are extremely important. For people to develop the relationship with their service provider means that they are able to establish some form of trust. And when you have that trust and that relationship established, you're much more likely to actually access or to ask for the services that you need.
So in smaller communities in BC, people tend not to access services within their own communities because of the relationships within health centers. So their cousin, their aunt, or somebody they know may be working within that organization. So I think it's important as healthcare providers to be able to provide that service and ensure confidentiality, or at least have that patient or that client or that community member know that they can access services out of community and in public health.
Clients often will feel it's not so much that they're embarrassed themselves about the disease that they have, it's more they're worried about what other people are going to think and that other people are going to judge them. We're located in an outpatient department where there's a lot of other services, so if people come and wait in our waiting room, nobody knows that they're specifically here to see the liver clinic. We do things like we specifically didn't put viral hepatitis in the name of our clinic.
Doctors have sent people home saying you've got a death sentence and you're gonna, die basically. Right, and so there's a lot of misinformation that has gone out. So, but then on the other hand, they'll say, go home, don't worry about it. You're good for 20, 30 years before it affects you.
I didn't know anything, and I still don't really, to a degree, but, it gets you thinking, what's the treatment and that, and if there is, and how long does it take, is there a way to cure it, and that sort of stuff.
Both people living with hepatitis C and service providers told us there are many critical knowledge gaps about the virus and how to fight it. These gaps can be filled through education, public awareness campaigns, and up-to-date guidelines. Those affected need to speak out and be heard.
As an educator at the BC Centre of Disease Control, I constantly get phone calls from physicians, nurses, and peer educators, outreach workers, asking me what to do with their clients that have hepatitis C. Whether it being working in rural and remote areas or within major urban cities, they don't know. They don't know what to do with these people. And it's really strikingly obvious that people are getting lost in the system.
I discovered that there was a very large knowledge gap in the healthcare profession when I discovered that I had hepatitis C. When I was talking to other nurses, we knew that it was a virus that did some damage to the liver, but really didn't know that much about it. When I went to visit my doctor, we did blood enzymes for my liver and found that they were still not too far out of normal, and so my advice was just to carry on and pretend like I didn't have it. And I was a little concerned with that because I had heard it could do long-term damage, so that's when I started to do more research and found out that it does have long-term implications.
When a health professional says there is no cure for hepatitis C, they're absolutely wrong, because there's a lot of treatments out there.
It's multifaceted. There's employment implications because of misinformation. I've had a number of advocacy issues around helping people keep their employment, especially in restaurant areas and things like that. Being that it's transmittable only blood to blood, and universal precautions are effective, there's really very little that someone that's infected with hepatitis C cannot do.
We really need to spread the word, both to the general public and people living with Hep C and the social service and healthcare community, that there are treatments, that Hep C can be cured, and that we can do something about it.
There should be more education in, I would say, the healthcare. So maybe in the medical schools and the nursing schools about hepatitis C, and start and bring it into the forefront like the HIV and hepatitis B are, so that people recognize what it is, how it's transmitted, what the dangers are, what damage it can do, what the treatments are.
So when the patient comes in, we explain them that yes, it's possible that your family doctor doesn't know anything about that because it's not his kind of work or whatever. So we are the specialists here, and we're going to give them the good answer. But more and more, we're starting to do some conference, either for nurses, pharmacists, and family doctors also, so they can know more about that disease and they know more about what we can take charge of here in the Région Lanaudière. So they know the resources, and I can tell you that now I have some family doctor who call me and say, if I say that to the patient, is that correct? And I says, okay, yeah, that's correct, and you understood well, and you know, so it's starting to get a little better, but there's still a lot of work to do.
If you feel you're getting misinformation, it's important for you to double check that information, whether it be looking at on the internet and look at taking that information to your healthcare provider and double checking the information with them. Ask lots of questions.
Speaking up for themselves is critical, because if they don't, they'll be left by the wayside. Self-advocacy is an absolute must.
It's really, really important to speak up. We learned so much from talking to people, and the people that were successful in accessing care had to speak up loudly and clearly, and sometimes they had to speak over and over and over again with their needs. So no for them meant try again. And I think that's the thing that's most important. On the other hand, for people that are ill, that are feeling stressed, it's really difficult to hear this message that you need to speak up because you're already stressed. So the thing to do, or one of the things that people have taught us that they do, is they find someone else to help them speak up. They find a family, a friend, someone that they trust to speak on their behalf, or take them with them to their appointments. In that way, they can be a little bit more assured that, one, they'll hear the messages that they're getting from their provider, and two, that the person will help them to speak up so that the provider hears the message, most importantly, that they have to deliver about what their needs are and why they have to have them met.
The treatment itself is very, very difficult. You never know what you're going to expect the next day from it. In my, I'm suffering from psoriasis, skin disorders at times, stomach disorders, extremely fatigued because of your drop in your red blood count. And so you walk up a flight of stairs, you are exhausted. My concerns in the long term would be how much rehabilitation it's going to take to get me back into shape. And what other side effects? You never know what the side effects are going to be on this treatment. It's very fascinating in a sense.
People we spoke with said they weighed costs and benefits as part of their decision making about whether to go for testing, follow-up, and treatment. Some decided not to go. As Clifford pointed out, there are many things for people to consider when deciding on treatment with a course of antiviral therapy that can take up to a year.
It's clear that people are undiagnosed, and so we need to have better testing and diagnosis. And with that is the increasing need to have the right amount of clinical assessment. So it's not just about being diagnosed, it's about being assessed, the person getting the right knowledge in terms of their clinical status so that they can make an informed decision about what's best to them. And if they need therapy, then they should have access to that therapy, and that should also be provided in a way that is not stigmatizing, and it provides the services that need to be provided for that individual.
So some clients don't feel that it's worth it to go through treatment, which can be quite onerous and really harsh, often because they aren't even having really symptoms of the Hep C. And so they don't see the benefits down the road to their life to go through this type of treatment when they aren't even feeling that bad.
By the time you have symptoms, it's already has started to cause too much trouble to the liver and start having other complications to the liver, and it's much more difficult to treat. The early on we get the diagnosis, easier, or not easier, but more like we have better options and better chances of actually treating the patient, and hopefully we can get a cure from it.
I'm a geriatric nurse, so I look after people at the end of their life when all of these long-term chronic diseases have taken their toll on people, and had seen people with liver cirrhosis and liver failure at their end of the life. And I also knew that hepatitis C is one of the leading causes of liver transplants, and I didn't want to go there. So I thought, you know what, to me it's worth it, and to me it's worth it to do it now while my body is younger and stronger and I'm better able to tolerate the tough chemotherapy regime that goes with it.
I really don't look past, the day-to-day basis. I look to see where I'm going to eat today, where I'm going to sleep, where I'm going to get my next fix so that I'm not sick when I wake up tomorrow.
In our research, people described competing priorities that took up their time, money, and attention. These competing priorities resulted in them putting hepatitis C into the background and delaying or canceling going for care. In this section, we highlight how competing priorities can impact on preparing for treatment.
It's challenging to support a person to go through treatment when they're feeling good in the here and now, and they have enough other things to deal with in their life, like where am I going to get my next meal, or do I have a house to live in, when they're not feeling that bad. So they can't really cope with the realities of the treatment, even though in the long run their life may be a lot better off.
They could not go without working, and so they chose to put off the treatment, and they also could not afford it because at the time I went through treatment, if your liver enzymes weren't over a certain level, then the treatment wasn't funded and you would have to pay for it yourself. So I think the course of treatment was about $28,000, which is nothing to sneeze at.
It took me quite a while to decide to treat. My husband was treated first, and then he got sick, and so I would say it took me probably about 5 years to decide to treat. And yeah, at least 5 years. I kept probably, at that point I was procrastinating and putting other things as a priority. My husband. So, and his illnesses, and then I decided to start focusing on me more.
There's other patients that are unstable, there's social issues, there's other priorities. So we try to make sure that they are ready to go onto the treatment. If they're not stable, we're not going to get them on treatment. They have to be ready. Mentally, physically, emotionally, they have to be ready for a treatment. So if there's unresolved issues, it's not going to work for these patients.
We can plan the treatment in their life. It doesn't mean that because they have Hep C, they have to be treated right away. And this, they have to understand that. But once it's understood, it's very easier. It's much easier like that for the patient. So he can see in his life when it will be the best time to do the treatment.
When people do decide to make treatment a priority, many were discouraged by the lead-up time. It varies according to the patient's health and can take several months.
If you were going to run a marathon, wouldn't you want to train first? And so we try to normalize or make it that, everybody has to go through this process to be able to get ready to go on this treatment. We very, very much believe that if you're ready to do this treatment, you're going to be much more successful on it.
Both the doctor and the nurse spent time with me explaining the benefits, everything pertaining to the treatment, what I would expect, symptoms, all of that. So side effects, I mean, of the treatment. So I really, I didn't hesitate.
We can accept some patients who are still using drugs or drinking alcohol, but of course we're going to try to explain them that the best way is not to use drug or alcohol. So we can start the treatment even though he's still using, if it's the drugs, he's still using drugs, but we have to make sure that the patient will keep a good organization. So he will be still very organized so he can take his treatment correctly, okay? And also we're going to try to send them to some people who takes care about abuse substance. So it can be maybe on a program of methadone or whatever.
They need a lot of support, just like the needle exchange programs, education, access to treatment, access to support groups, access to healthcare professionals to support them through their disease process and encourage them to go through the treatment and hopefully go on to a healthier lifestyle than what they've been engaged in.
I get emotional around this topic because I see so much abuse of doctor privilege, of the power they have, and I've had to sit bedside with people in intensive care and watch them pass away because they couldn't get the medical care they deserved, strictly as a human being. Whether they're clean, dirty, old or young, it doesn't matter. They're human beings and they deserve to be treated as such.
No matter who is affected, whether their lifestyle is stable or unstable, everyone has a right to health care and services. Together, we can find a way to make this goal a reality. We hope that hearing these voices will encourage compassion and innovative change in the fight against hepatitis C. We leave you with some thoughts on moving forward.
In the context of healthcare providers, it's very clear that we've gone from not knowing what hepatitis C was in 1989 to now having an agent, having tools to diagnose it, having tools to monitor therapy, and now having increasingly more and more effective therapies. This has all happened over the last 23 years or so. And it's important to recognize that clinicians and healthcare providers get very minimal training in the context of hepatitis C. So I think it's very important for healthcare providers to learn about these new options for patients, both in terms of diagnosis, management, assessment, and also therapies. It's also important for patients to be just as knowledgeable about the things that are available to them in terms of diagnosis, assessment, and treatment, because it's very hard to train healthcare providers because they have to learn a whole slew of different illnesses. So it's very important that patients learn as much as they need, or individuals learn as much as they need, because they will come across providers who are not as knowledgeable as they are in terms of hepatitis C, and they'll need to be able to express their knowledge so that the healthcare provider will meet their needs.
I would encourage healthcare providers and social service providers to not make assumptions. Even if someone is actively using or living a lifestyle that you might think doesn't prepare them for treatment, people care about their health, and if we can work as a team and just offer options and ongoing support in a really non-judgmental way, people will do amazing things. And so I see down the road the need for really holistic, welcoming treatment programs where people can have a say in their health and they can be treated with respect and they can be offered treatment, which they really should have a right to.